Hi all, thank you so much for watching this video. Today we will discuss about ECG or EKG, which is called electrocardiogram. For a better understanding of the ECG, I have divided this class into three sections. The first one is placement of ECG leads or electrodes, and the second one view of the ECG leads, and the third one understanding PQRST and the boxes. It is a graphical representation of the electrical activities of heart or the cardiac muscles. The function of ECG is to evaluate the heart rate and determine the heart conditions. Next is the types of ECG. There are three main types of ECG. First one is resting ECG, second one is ambulatory ECG, third one is stress test or treadmill test. In the resting ECG, the patient will be lying in a couch or in the bed and we will do the ECG. In the ambulatory ECG, in this type of ECG, a portable device is connected to the patient and the ECG or the cardiac rhythm will be monitored and recorded for 24 hours. The third one is stress test or treadmill. And this one, the patient ECG is evaluated during a physical activity. In this, we will ask the patient to run or walk in a treadmill. This is called stress test or treadmill. So, who performs the ECG? After getting a verified order from the doctors, the ECG technician or the nurse will do the ECG. At the same time, if the situation is very emergency, we can do the ECG without prior advice or order. So now we will speak about the placement of electrodes during an ECG. For the ECG, we have to keep 10 electrodes in different parts of the body. These 10 electrodes can be divided into 6 and 4. That means 6 chest leads or precordial leads, or 4 limb leads or 4 extremity leads. For this 6 chest leads, it can term like V1 to V6. This V1 to V6 is kept on the chest. The placement of each electrode should be very accurate. Even though we have applied 10 electrodes, but we are actually getting 12 views from different angles. So, taking the ECG with an accurate placement is playing a very vital role. So, starting from V1, it is kept on the 4th intercostal space on the right sternal border, and V2 on the 4th intercostal space on the left sternal border, V3 which is kept between V2 and V4, and V4 5th intercostal space mid clavicular line just below the nipple line, V5 5th intercostal space left anti-axillary line, V6 5th intercostal space mid axillary line. For the limb leads, we are keeping on the extremities, one on the right wrist and other on the left wrist, and other 2 limb leads on the one on the right angle, one on the left angle. So now we understood where to place the electrodes and to do an ECG. After generating the ECG, that means the ECG machine will give us the ECG report in a ECG graph paper. It is composed of horizontal and vertical line with light and dark line that indicate 2 small and large squares. The ECG graph paper is globally standardized, so wherever you go, it will remain the same.